non-surgical nose shaping procedure is a procedure with a real wow factor. However, out of my two subspecialties, I would say, the two wow treatments, I would say that this procedure, the non-surgical nose shaping procedure, has got an even huger wow factor. A little bit of history. Noses have always been an obsession of humankind. People have always been obsessed with the bumps on the noses, with the hooked noses. They're not straight enough, they're too fat. In fact, the history goes all the way back into the 17th, 18th century, where a legendary Indian surgeon, Sushruta, was actually operating on noses where princesses and women who cheated on their husbands, the punishment of those days was to cut off the nose. He was reconstructing the noses, and in fact, the reconstructions Sushruta had devised in those days are still being used. To continue with the history a little bit and to bring it forward, in the 1960s, my father, Professor Boško Milojević, was one of the first plastic surgeons in the whole of Europe. In fact, in the 1960s, 70s and 80s, he was a big friend with plastic surgeons such as Ivo Pitangui and was widely regarded as being the best surgeon for surgical rhinoplasties. His surgeries were perfect and very rarely were there any problems after his surgeries. About 6-7 years ago, I was one of the first doctors in the UK to learn the procedure of non-surgical nose shaping, and it is now one of my favorite procedures. What's amazing about the procedure, it really can replace the surgical rhinoplasty in that even with big noses, we can, if there is a bump on the nose, we can fill with a hyaluronic acid dermal filler like Restylane or Perlane with small amounts with a thin needle. It's a 5-minute procedure. We can fill the dents above and below the bump. If the nose is crooked to the side, we can put the filler on the other side to straighten it. If the nose is drooping down, by putting some filler in this region, we can bring up the nose, and even by placing some Botox under the nose tip, we can raise the nose tip. Indeed, after surgical rhinoplasties, if there are unevennesses and bumps in the middle of the nose, as I explained, it's so perfect. With careful application of hyaluronic acid filler, we can straighten the nose, we can fill in those bumps. It's a painless procedure, it's a procedure with a wow factor. It can really replace rhinoplasties in most cases, and in fact, even with the biggest of noses, if the patient wants to try this incredible procedure, even if they're not completely satisfied with the results, they can still go on and have the surgical rhinoplasty. Finally, I highly recommend this procedure as it is a procedure which amazes.